Intermittent fasting has become one of the most talked about health trends in recent years, promising everything from weight loss to improved brain function. But with so much buzz surrounding it, it's easy to wonder, is intermittent fasting really the miracle solution it's made out to be? Or is it just another passing fad? The truth is, like most things in health and wellness, intermittent fasting isn't a one-size-fits-all approach. It has its benefits, but it also comes with potential downsides that are important to consider. Today, we're diving deep into the science, the pros, and the cons of intermittent fasting to help you decide if it's the right choice for your lifestyle and health goals. To understand intermittent fasting, let's start with the basics. Intermittent fasting isn't a diet in the traditional sense, it's more of an eating pattern. Instead of focusing on what you eat, it's all about when you eat. The most common methods include the 16/8 method, where you fast for 16 hours and eat during an 8-hour window, and the 5-2 method, where you eat normally for 5 days and restrict calories to about 5,006,000 on the other 2 days. There's also alternate day fasting, which involves alternating between days of normal eating and days of fasting or severe calorie restriction. The idea behind these methods is to give your body a break from constant digestion, allowing it to tap into stored energy and potentially reap a host of health benefits. One of the most well-known benefits of intermittent fasting is weight loss. By limiting the time window in which you eat, you naturally reduce your calorie intake, which can lead to a calorie deficit, the key to shedding pounds. But it's not just about eating less. Intermittent fasting also affects your hormones in ways that can promote fat loss. For example, fasting increases levels of norepinephrine, a hormone that boosts metabolism and helps break down fat. Additionally, insulin levels drop during fasting, which encourages your body to use stored fat for energy. Studies have shown that intermittent fasting can be just as effective, if not more so, than traditional calorie-restricted diets for weight loss. A 2014 review published in the journal Translational Research found that intermittent fasting led to significant reductions in body weight and fat mass in participants. Beyond weight loss, intermittent fasting has been linked to improved metabolic health. Research suggests that it can lower blood sugar levels, reduce insulin resistance, and decrease the risk of type 2 diabetes. A study published in Cell Metabolism in 2018 found that intermittent fasting improved insulin sensitivity and reduced fasting glucose levels in pre-diabetic men. This is likely because fasting gives your body a chance to regulate blood sugar more effectively and reduces the strain on your pancreas, which produces insulin. Additionally, intermittent fasting has been shown to lower levels of inflammation in the body, which is a key driver of many chronic diseases, including heart disease and cancer. A 2019 study in Nutrients found that intermittent fasting reduced markers of inflammation and oxidative stress, both of which are linked to aging and disease. Another exciting area of research is the impact of intermittent fasting on brain health. Fasting has been shown to increase the production of brain-derived neurotrophic factor BDNF, a protein that supports the growth and survival of neurons. Higher levels of BDNF are associated with improved cognitive function, better memory, and a reduced risk of neurodegenerative diseases like Alzheimer's. Animal studies have also suggested that intermittent fasting can enhance brain plasticity, which is the brain's ability to adapt and form new connections. While more research is needed in humans, these findings are promising and suggest that intermittent fasting could be a powerful tool for maintaining brain health as we age. But before you jump on the intermittent fasting bandwagon, it's important to consider the potential downsides. For some people, fasting can lead to negative side effects like hunger, irritability, and difficulty concentrating, especially in the beginning as your body adjusts to the new eating pattern. These symptoms are usually temporary, but they can be challenging to deal with, particularly if you have a busy or demanding lifestyle. Additionally, intermittent fasting may not be suitable for everyone. People with certain medical conditions, such as diabetes or eating disorders, should approach fasting with caution and consult their healthcare provider before starting. Pregnant or breastfeeding women, as well as children and adolescents, should also avoid fasting, as their bodies have higher nutrition needs. Another potential drawback of intermittent fasting is the risk of overeating during eating windows. Some people find that they compensate for the fasting period by consuming larger portions or indulging in unhealthy foods, which can negate the benefits of fasting. This is why it's important to focus on the quality of your meals. even if you're eating less frequently. A diet rich in whole, nutrient-dense foods like fruits, vegetables, lean proteins, and healthy fats will help you feel satisfied and provide the nutrients your body needs to thrive. It's also worth noting that intermittent fasting isn't a magic bullet for health. While it can be a helpful tool, it's not a substitute for other healthy habits like regular exercise, adequate sleep, and stress management. Social and lifestyle factors are another consideration when it comes to intermittent fasting. Fasting can make it difficult to enjoy meals with family and friends, especially if your eating window doesn't align with theirs. It can also be challenging to stick to a fasting schedule if you have a job or lifestyle that requires flexibility. For example, shift workers or people with irregular schedules may find it hard to maintain a consistent fasting routine. It's important to choose a method that fits your lifestyle and allows you to maintain a healthy relationship with food. After all, the goal of intermittent fasting or any eating pattern should be to support your overall well-being, not create additional stress or hardship. So, is intermittent fasting worth trying? The answer depends on your individual needs, goals, and circumstances. If you're looking for a structured approach to weight loss or want to improve your metabolic health, intermittent fasting could be a valuable tool. It's also a great option if you're someone who prefers fewer, larger meals over frequent snacking. However, if you have a history of disordered eating, a medical condition that requires regular meals, or a lifestyle that makes fasting difficult, it may not be the best choice for you. As with any health intervention, it's important to listen to your body and make adjustments as needed. Ultimately, the truth about intermittent fasting is that it's neither a miracle cure nor a dangerous gimmick. It's simply one of many tools you can use to support your health. Like any tool, it's most effective when used thoughtfully and in combination with other healthy habits. If you're curious about intermittent fasting, consider starting with a shorter fasting window, like 12 hours, and gradually increasing it as your body adapts. Pay attention to how you feel, both physically and mentally. And don't be afraid to experiment with different methods to find what works best for you. Remember, the goal isn't perfection, it's progress. Whether you choose to try intermittent fasting or not, the most important thing is to make choices that nourish your body, mind, and spirit. After all, true health is about balance, not extremes.